Hello, everyone. Thank you for joining us for today's webinar, and we hope you're ready for an enlightening session on treating neurological conditions. We have a fantastic webinar prepared for you today. My name is Myra Chen, and I'm your host and moderator for today's session. Here at eLotus, we have been dedicated to delivering high-quality educational courses for over 3 decades. We take pride in being your go-to source for premium CU content, featuring over 200 speakers, 700 courses, and 3,000 hours of CE. I'm thrilled to introduce today's speaker, Dr. Peter Shark. Dr. Shark brings over 15 years of experience in acupuncture, Chinese herbal medicine, functional medicine, and nutrition. His expertise in crafting personalized treatment plans and lifestyle modifications has led to transformative results for many clients. Alongside his wife, Nico, Dr. Shark runs Shark Holistic Health, a telemedicine clinic that serves patients across the U.S. How many of you find it challenging to address neurological conditions in your practice? Please type yes into the chat room if you share this experience. Additionally, what aspects of treating neurological disorders do you find most difficult? We'd love to hear your thoughts in the chat room. Today's webinar, Integrative Wellness, a focus on treating dysautonomia, POTS, and other neurological conditions with Dr. Shark, aims to provide you with valuable insights and strategies for managing these complex conditions. This class will dive into the anatomy and physiology of neurological disorders, offering an integrative approach that combines Chinese medicine with modern treatment methods. Our eLotus team is both excited and a bit sad to host Dr. Shark's final webinar of the year, marking the conclusion of his highly popular 4-part series. If you haven't had the chance to attend his previous sessions, I highly recommend checking out his March 8th class, Restoring the Gut-Liver Axis with Nutrition, Herbs, and Functional Medicine, his June 21st class, Integrative Wellness, a focus on liver and gut detoxification, and his August 16th class, Integrative Wellness, a focus on autoimmune management. Each session builds on the last, creating a comprehensive learning journey. I'll post a link in the chat room to all the courses he offers, including previous classes on gut health and using herbs to treat long COVID symptoms. For our new attendees joining us today, let me guide you through our webinar room. Please adjust your chat setting from host and panelists to everyone so that all participants can be part of the conversation. Use the Q&A box for any questions during the webinar to keep them separate from the chat room. And don't forget, the CU quiz will be available the next business day, late afternoon, for those with qualifying attendance. Now, let's dive into today's webinar, and please give a warm welcome to Dr. Peter Shark.
Okay, hello, welcome. Before we get started on the PowerPoint, I would love to know who's here today. Let's see. We've got 93 people logged in so far, and I'm just curious about how long you've been in practice. That's the main thing. How long have you been in practice so far? I want to know if we have a lot of new people. Okay, a lot of people with a lot of time. Excellent. I don't assume anything about your experience based on your years in practice because you either learned stuff or you didn't. And we all get different exposures to information. Okay, it looks like it really runs the gamut. Lots of people with more than 10 years. Excellent. Okay, welcome. I'm going to try to ask you a lot of questions in the chat because it can be a little weird and talking to myself for 8 hours. So if you have big questions like that I need to explain something, please put that in the Q&A. If it's just like, what did you just say or something, you can put that in the chat. I'll try to keep an eye on it. If I miss your question, put it in the Q&A, please. Okie dokie. All right, hopefully everybody can see that okay. I don't know why. Whenever we rehearse, everything goes exactly how I want it to go. And then when we come into the actual class, the sharing gets all weird. Okay, now I got the view I want. Okay, so we're going to talk about mostly POTS today, but also things that look like POTS. So autonomic problems that deal with blood pressure, heart rate, orthostatic intolerance, etc. And we will go into detail on what all of those things mean. This is me. Here's my contact info. You should be able to download the slides from the page that you clicked to join the webinar today. So I've got a couple of handouts on there too, and I might add a couple of more depending on what we use in the class. Finally updated my email address to Shark Holistic after 2 years, but I still get them at the old one if you forget. If you're interested in a case study group, a group of people who gets together on a regular basis and discusses our actual patients and what to do with them, how to approach them, please email me and let me know. I'm trying to put together a group of students who want to do this. So I need like at least like 4 people who can meet at the same time every month or every couple of weeks or something. So I've been in practice 18 years. I've had clinics in San Francisco and Pensacola, Florida. I now reside in Mexico. I do a lot of education myself. I think it's really important. I like learning things and I want to be a better doctor. So whenever something sounds interesting and sounds like it might apply to my patients, I will take that class. I take a lot of classes here at Lotus, and I take a lot of classes that are geared toward functional medicine for MDs and or chiropractors also, which I don't get any credit for. So credit's not particularly important to me. I just like to learn things and help my patients. I study a lot of functional medicine. I really like physiology. It helps me understand my patients and figure out what the best approach is to treat them. So in my mind, I'm always doing a translation between the physiology and the Chinese medicine terminology and back, because I think that's really important. I prescribe herbs based more on the Chinese medicine terminology and then everything else based on physiology. And that works pretty well for me. You have to decide what kind of doctor you want to be. You can be a Jimmy Chang where like you don't really ask people questions. You take the pulse, you give the herbs, and that's that. And that's great. That's fine. I mean, obviously he's very successful. Or I'm on like the other end of the spectrum as far as process, which is spending a lot of time with people, really trying to analyze the physiology and figure out how to approach it from there. My clinic is called Shark Holistic Health. I work with my wife who does nutrition. She's a nutritional therapy practitioner uh, in Florida. I mean, in California, and a holistic health coach in Florida because the licensing is different in those 2 states. We have a 100% telemedicine clinic. So our patients are in the United States and we live in Mexico and work here on Zoom. We prescribe herbs, we do supplements, and we do nutrition. It's all customized for that patient. This is basically who we treat, and I think it's really important. The reason I'm sharing this part with you, what does my clinic do and who do we treat, is I think it's really important to get clarity on this. If you're really new, it may be too soon for you to have clarity, but just think about it. Notice, who do you get good results with? Who do you like working with? What fits your model? What fits the model of how you run your business? So if you're running a clinic where you have 10 minutes to talk to people and then you do acupuncture, it's probably not that well suited for chronic conditions unless you're going to be more like a Jimmy Chang where you're just doing herbs and a couple of pieces of advice for that, and you're not doing a lot of like intensive management. To do what we do in our clinic, you need a lot of time with people because it doesn't take me necessarily a lot of time to figure out what I want to do, but there's a patient management side to it. So people need a lot of contact in order to follow through with comprehensive plans. And so making the time for that contact to build the rapport and the trust and to coach them and walk them through it and get them comfortable and answer their questions and help them through the bumps. It's really, really critical. Otherwise, people just aren't able to follow through very well. So we basically work with chronic conditions, people who've already seen a lot of people and aren't. This is my ideal patient, and I would suggest that you spend some time thinking about this. The way I came up with this description is who have I gotten the best results with? Who's easy and fun to work with? Where when this type of person comes in, I feel like this is going to be great, right? I treat people who don't fit this ideal. I don't just say, well, you don't fit my ideal. I'm not going to treat you, but it's good to know who you want, who does best in your clinic, right? And so like right now, we're getting a lot of 20 somethings. I'll take them, but they're harder to work with because they haven't had enough failure in other places yet to understand that they're really going to have to work hard to get better. So, my ideal patient is a 40 something female because women tend to take their health more seriously than men, sadly, who has a chronic illness that is interfering with her daily life and she knows it. She's already seen at least a few MDs, has tried conventional treatment and it didn't work, right? That's really key because otherwise people come in expecting a magic bullet. There's kind of a subset of people who think that alternative medicine is just going to magically cure them overnight, and they don't. They don't want to make changes to get there. They don't want to take supplements. They don't want to change their diet. I don't know how they think we can help them, but they do come in sometimes. So I'm looking for somebody who's not ready to dedicate her time and energy to getting well, and it just needs to know the right thing to do. Right? They've tried stuff, it's not working. They're confused. They don't know the right thing to do. They need somebody to tell them the right thing to do. That's a perfect person. That person gets excellent results in my clinic. It's just like they take off. They're a joy to work with, and everybody's happy. This is who we don't treat. People who don't want to change their diet. That's really, really important. Patients who don't want to take any pills, that's going to be, it's just going to be such a barrier. I probably wouldn't take them. Patients who really give the vibe like they're looking for a magic pill, that's not good. Some people say, oh, I don't believe in Western medicine, but they also won't do anything to help themselves, right? Those people are just going to be sick. um, Patients who somebody else thinks should come in. This happens all the time. Either even their acupuncturist who refers them or a family member. I mean, I get these texts like, can you make an appointment for my son? How old's your son? 38. No, your son has to contact us. If he can't fill out an online form, then doing what we do is going to be too hard. So we can't have somebody else cannot motivate the sick person for them. They need to be invested. Uh, and anyone who's not comfortable using Zoom or text is not a good fit for my clinic because we're telemedicine, right? And so if we're having trouble communicating right off the bat, they can't return texts or things like that. That's just it's gonna be a disservice to that patient if I take them on because they're not gonna get what they need from me. They need, in-person contact in order to be able to follow through. And that's just sometimes that's an age thing. Some people just can't do this format. I think it's really important to be honest about who you can treat, who you have the capacity to treat, both your education and also the way that your office is set up. So, if you are you really set up for complex cases? If not, can you change something about the way that your office is in order to be set up for complex cases? I think when I did acupuncture, I split my day. I had acupuncture blocks and I had consult blocks. I did that for a while in my clinic in San Francisco. And then when I moved to Florida, I was seeing more patients that were really doing both regular consults with me to do functional medicine, herbs, that kind of thing, and doing acupuncture. So then I moved to a thing where I would do a consult and then I would do 3 or 4 acupunctures and then cycle back to a 30-minute consult. And so that was a good rhythm for me. I don't need a lot of time to do acupuncture. In my clinic, acupuncture was not talk time. It was just get on the table, do acupuncture. If we need to talk, that's consult time. And so I split those things apart. They're separate appointments, they're billed separately. That way, the people that I'm spending more time with are being billed for that time, and the people that are just coming in for quick acupuncture are being billed only for that time. If you want to go over cases, if you feel like I've got a patient, I think I can handle it, but I just want some support or I want to bounce some ideas off of somebody else, I'm happy to do that. We can book appointments for that, and I discount those over my regular rate. I gotta say though, probably 75% of the case questions I get boil down to these things under a note about treating patients. One, it's just not going fast enough because the patient's not coming frequently enough in order to get multiple changes implemented, right? And so you really can't fix people overnight. It takes time, and it takes frequently with chronic conditions, it takes multiple changes. So if they're only coming in once every 2 weeks, once a month, it's going to take so long. You're going to feel like you're not going anywhere, even if you do everything right. Unwilling patients is the other one. People say, how can I get the patient to follow my advice? I mean, to me, more contact, more time, more rapport helps this a lot. So spending time with people, talking to them, um, making that relationship, just giving people advice as a flyby. It just human psychology doesn't work that way. And so people, they don't end up following through. So they do need that relationship in order to help them follow through and move forward. And that's one reason that I, like to see people for follow-ups on a regular basis. So you build trust with them, you help them through. Once they see that you're not going to judge them for not doing it right, they see that you help them through the bumps, that you have the knowledge to navigate. That just builds trust, and then they're more likely to follow through on your advice. And then the other big mistake I see is that the information is just like so scattered. It's not well organized information on the patient history, like what's really going on here. The treatment is changing focus every week or two or every month. That doesn't work well for chronic illness. People with chronic illness, their symptoms are really constantly changing a lot of the time. And so if we're saying, how do you feel today, and trying to solve that problem, we don't get anywhere with the underlying issue. So if you work with people that are really ill, taking a thorough history, and for me, I need to do this when I'm by myself. So I take a thorough history, I make the plan when I'm by myself, we come back together, I explain the plan. I'm not doing it on the fly. It's just how my brain works. I need like quiet time to think about what's going on with this patient. Where do I want to take this patient? What's the best approach? Kind of what are a general order that I think I need to move in with my major goals with this person? What are some of the treatments that are popping into my head that might be appropriate? And I make all these notes in advance. So um, I just, the way that my brain works, it works better if I have some time to myself to think through these things, to take the notes, to write it down, and have that to refer back to as I'm treating. Otherwise, it's so easy to get lost, to not be able to see the forest for the trees, right? To be in the middle of the ups and downs and not remember what is the big picture here. So this is how I treat, and you're welcome to copy me if it works for you. The first appointment I do with patients is called a new patient consult. I don't intend to treat or really even evaluate medically in this appointment. Patients fill out something on my website. It's a really, really brief, just overview of their condition and their main goals. That gets reviewed first. And if it looks like their condition and their goals match what we do, then I will book that patient for a new patient consult. I'll answer this question, Wayne, as we go through. So the new patient consult, the point of that in my clinic is just for me to get a kind of a face-to-face sense of this person. I want their goals to be realistic. If their goals are really unrealistic, that's a concern for me, and I want to address that before they start spending a lot of money and time with me. So, for example, they come in for the new patient consult and they have cancer. They don't want to do conventional treatment, and they think that I can cure it. That's a red flag for me. So I'm going to want to have a conversation in that appointment with that patient that I don't cure cancer. I can support them. I may be able to help in some ways, but that I would not expect to cure them through my treatment. And I'm going to gauge their response to that. If they are totally on board with that, I might take them on. Anyway, sometimes people have a good reason for not doing conventional treatment, like there's no good conventional treatment available for the type of cancer they have, and they want to focus on quality of life or whatever it is. That's fine. But I want to make sure we're on the same page with expectations. If I find out like they hate taking any pills, I'm going to address that right away. We're probably going to suggest a lot of supplements. If that's going to be a deal breaker for you, maybe we should move forward. So it's kind of a weeder appointment. I don't want to, by the time I do the intake, I feel like I'm committed to this patient because I've taken a lot of time. They've paid me a fair amount of money to evaluate them. So once I do the intake, like I'm going to treat them. So I'm trying to weed in this first appointment. If somebody is inappropriate for our practice, I don't think they have the right motivation. I typically don't take people who smoke currently because it's just been every time I do, I regret it, and they're like failure case. Um, yeah, so that's one thing I screen for right off the bat. Current smokers usually don't do well even if they want to quit. When I had an acupuncture practice, I would put them through a quit smoking program first, but there's not enough support to do it telemedicine. They really need the in-person ear acupuncture in addition to amino acids and other stuff. Okay, so after that appointment, the new patient consult, if the patient seems like a good fit, the rapport is there, they seem like they're on board, we'll have them do an intake. Occasionally, I'll do something else with people, like just prescribe herbs or something based off of that first appointment. But generally speaking, we're going to go into an intake. That's 2 appointments on the same week that are an hour and a half each. First one is really the intake part. I have a really extensive paperwork I have them fill out on my website. It's like takes them an hour or two just to fill the paperwork, and it's just a screening for pretty much anything that could be wrong with a human being because people's reports leave out a lot of stuff that's relevant to me. So, they're like, oh, well, I've been constipated my whole life. I don't care about that. Well, I care. That matters for their treatment. So I want to screen for all their problems. So in that first appointment, it's me, my wife Nico, who does nutrition, and the patient all together on Zoom. And we are asking, we go through a medical history, birth to present, every kind of medical problem they've ever had, accident, injury, illness, medical treatments, surgeries, medications, all of it, any of it, even stuff that's like normal, right? So just, like chickenpox, whatever, normal stuff, ear infections. We're looking for, what's been going on with this patient since they were born. How far back do these problems go? Like people have signs of dysbiosis, for example, from infancy. They have colic, they've got chronic ear infections, right? So that's like lifelong dysbiosis. Some of them have liver problems that go all the way back, things like that. So that tells us, how serious the issue is. A patient might report being sick for 5 years, but when we investigate, they've had some of these problems for 25 years. So that's really important, and it gives us a pattern and also some ideas about what some of the underlying originating causes are that we need to work on and treat. Second appointment later that same week, another hour and a half. In between those two, we do a write-up for them. And so, because the second appointment is an education appointment, I'm going to deliver a lot of information to the patient. And so, in that second appointment, it's going to be like overwhelmed for them because we're going to go through so many different ideas, a bunch of medical ideas that might be new to them. Some of them maybe they've heard before, some of them they've never heard that word in their life, and it's going to be like a lot to take in. So we've got a write-up that I screen share that goes through first their major complaints, right? Just to say like, hey, we know why you came to us, right? These are the things you wrote down. I asked people for their top 5 major complaints. So we put those at the top, and then we put what's called our findings. And findings are what's under the surface, what is happening in their body. This is more physiology, right? So it's not diagnosis, it's just physiology. So, I'm not saying like, I'm not giving them like a disease diagnosis. I'm saying things like, your low stomach acid or your liver is sluggish, doesn't seem to work very well. There's dysbiosis. You've got, multiple endocrine problems. You've got, global inflammation. We suspect insulin resistance, things like that. So this is going to be a list of anywhere from usually 5 to 20 things, depending on the patient. And we're going to go line by line, explain what all of these findings mean and how they relate to the complaints. So this has, multiple functions. One is the patient has a better understanding of themselves. The people who come to me, one of the things they don't like about the conventional approach is that they never really understand what's going on. And so that's, you know, that doesn't feel good when you're sick and you're struggling and nobody will explain to you what's happening with your body, why are you experiencing this, what can you do about it. So it's important to bring them in as like a partner. um, Also it helps them, it raises their confidence in you when they see that you have a big knowledge base, right? When they start to see that you know what you're talking about, you could talk about these things and not just medical terminology, but also explain it in a way that makes sense to a regular person is really important. And, you know, to me, like I want to talk in plain language and kind of like a physiological language. I don't want to talk about energy or anything that sounds magic, right? We're talking about bodies. Bodies have physical parts. So I'm going to talk about physical parts of bodies and how they function. So I want people to know I'm here on Earth. We're dealing with human bodies. This is not magic. I'm not magic. I'm not a magical healer. I'm a doctor, and a doctor is a person who has a lot of knowledge to help you get better, not a person who can heal you through some kind of personal magic, right? So I think that's important. And then we lay out a treatment plan. We lay out what we're going to focus on. So our chief focus, which is just like maybe 3 or 4 areas of focus, such as healing the digestive system, balancing inflammation, kind of big picture ideas like that. Can you view the paperwork that I give my patients to fill out? I don't think so, because I would have to give everybody access to I would have to give everybody like a password protected access to my website to do that. So no, but if anybody here wants to be in my case working group, I will give access to my paperwork to anybody in my case working group. Um, Absolutely. And then once we start treating, we refer back to the treatment plan to guide the treatment, right? Because I know everybody in here has had the experience of working with a complicated patient, at least I think you probably have, where um, you're hitting these bumps with somebody, and then at some point you start to feel kind of confused or lost, or you've kind of lost the plot, you don't know where to go next, or you feel like you're failing and you can't figure out what's going wrong, right? I mean, I've had that experience, and I assume that it's a normal experience if you work with complicated people over time. So that's why we reevaluate. We have a treatment plan to refer back to, and then we reevaluate. I've noticed that most people, about 3 months is about how long I can go with them before I start to feel a little bit like in the weeds with them. And I need to come back and big picture the situation and really measure my progress. So, I write down all the stuff from the intake. And then when we do a reeval, we take the stuff we wrote down from the intake and we ask, how is that now? And we compare. And we literally write down this many problems have significantly improved. This many problems are gone. The patient does not have them anymore. And then this many problems are persisting, right? And so we can see percentages. We put it in percentage. Percentage improvement, percentage resolved, and that gives us an idea of where to go next. Frequently, when I think that things aren't going well with a patient, I reeval and discover that we just haven't been talking about all the stuff that went away. And so it helps me to know I'm on the right track and know what to do with people next. And it helps them to see their progress, not get discouraged, not drop out if they're making progress. It is normal to have bumps in treatment. Bodies are not linear. So it's helpful for all parties. Would I teach a business class for telemedicine? Yeah, sure. I mean, if that's something that people want, if that's something that people want, if enough people want it, I'll definitely teach it. We already have my classes for 2026 laid out. We're going to do a class on cravings and mood issues, using mostly supplements and herbs. And then we have a class on like diabetes and autoimmune, how to use fasting for those things, which are topics that have come up in other classes this year that people wanted more info on. But I would definitely teach a business class for telemedicine if there's enough people who want to take it. Because it's not obvious, right? How to set it up. Any questions on this part, practice management part? I want to address this before we move on. Okay. Oh, okay, good question. Do you have them collect and bring in their previous lab work? Okay. I like to go into the intake blind. I don't want to be too driven by the paperwork in the first appointment. So what I ask people to do is to submit their lab work from the last year, or if they have anything really, really significant from before that, they could submit that too. But mostly I'm interested in the previous 12 months. I don't look at that lab work until after the first of the two appointments. Then when I'm analyzing the information that I've gathered, um, that'll cause me to look at the lab work differently because I'm going to be looking for things like, what about this? What about that? What do we see here? So depending on how recent the lab work is, I may be able to, rule out a lot of things based on that, or rule things in. I frequently find things in people's labs that their doctor either didn't notice or didn't tell them about. I'm never quite sure which. I can't tell you how often I see people in like third stage kidney disease and their doctor didn't notice because that's not something that gets flagged by the lab. You're, if you're looking at GFR, glomerular filtration rate, which is usually the metric I use for that. And some people use bun creatinine ratio, but I just use GFR because it's easy. People are significantly impaired, not a word from their primary, because that's something you have to look at yourself. The lab doesn't turn it red for you. So if you don't actually read the labs, if you only look at the things they put at the top as abnormal, it's easy to miss. But I do love to see people's labs. There's a lot of clues in labs. You can really learn a lot about how someone's functioning or not functioning. And it's always surprising when I run labs. And then I will order labs. In that second appointment, one of the things we go over are the labs I would like to see. So it's good to see what they've already had run. Sometimes we need follow-ups on those same tests. Sometimes I'll be like, oh, you just had a CBC last month. We don't need to run that again. How often do I meet with the patient after the treatment plan? It depends on them. I'm just gonna take the share off since I'm answering questions. Uh, so it depends on the patient. I really like to meet people weekly a lot. I think that's the most effective. But not everybody's lifestyle and or pocketbook can handle that. So it depends on the patient, what they're available for. We usually lay out options. So they can meet us less often or more often, depending on their lifestyle and how fast they want to move. Some people I meet as often as twice a week in the beginning. That's great if the patient has the time to dedicate, because the thing is, we meet in the appointment and I'm getting information and I'm giving homework. We just call it homework. In that appointment. If they don't have time to do the homework, meeting more often is kind of useless. So we really want them to be able to think about how much time do I have to dedicate? If we meet twice a week, which is like our fastest plan, will I be able to implement multiple homeworks every week? And the homeworks are like um, add this food, take this food out, start taking herbs, start taking this supplement, right? Some of it might be lifestyle, like do a certain type of exercise, which we'll get to exercises I recommend for POTS later. A lot of times it could be just, take a walk twice a day, um, sit down. I want you to sit down for at least one of your meals and eat sitting in one place, right? Start doing this nervous system technique twice a day or something like that, right? So really, really clear homeworks. Like I'm not gonna say, okay, go keto and get back to me in a month. That's, it's really, really clear homeworks that the person knows exactly what they need to do and they have all the tools to implement it and then they can report back. Either they report back, I did it, it went great, I feel great. Or I did it, it was horrible, I feel horrible. Or I tried to do it, but it didn't work out because of XYZ, and then we coach them through the barriers. How do we get around these barriers? What's the best way to approach it, right? So less than once a week. Sometimes people do come every other week. Things move really slowly. In my experience, when they come every other week, they'll start off like trying to implement the homework, and then they fall off before their next follow-up. And so you actually have to be more self-motivated to come less often because they're not getting the support of just the feedback, the encouragement, the reminder of why we're recommending that thing that helps them to be consistent. What I love to do is to just be a cheerleader for the patient, to encourage them, to acknowledge their efforts, to help them through, to help them see the progress. If I have a good motivated patient, I get to be that person for them, and that's the most fun for everybody. The question is, are the labs paid for out of pocket or through their insurance? Because I'm telemedicine now and my patients are spread out, I typically don't order directly into like with a lab company like I used to. When I was in California, I would order directly with LabCorp. When I was in Florida, I would order directly with Quest, and those companies bill the insurance for the patient. Now I order through Rupa Health. It's like a dashboard of multiple lab companies so that I can order everything in one place. It saves me time. the patient has to pay Rupa Health for the labs. If they want their insurance to cover, they're going to have to submit. If they want it ordered straight through their local lab, some of them will go to their primary and request that their primary order the labs. That's not great because then they have to get a copy and then they have to send the copy to me and it's a pain in the butt. If I can order them, I get notified first. I have time to go over them and be ready to explain them to the patient when I see them next. That's ideal. So generally they're paying out of pocket and some of them have the type of insurance where they can get reimbursement. Some of the labs I run are really specialty and insurance doesn't cover them. I personally don't require labs to work with me. They are helpful. I like to explain to the patient exactly what labs would be helpful, why they're helpful, and also what might not be helpful about them. So I actually have videos on YouTube of most of the labs, the most common labs that I request, and what I use that test for, and kind of what the weaknesses of that test are. And I think that's really important to consider. And so I let the patient kind of consider the risk, the cost benefit analysis with some good information on that. So I'll recommend they choose, right? They decide. And that's how I work with patients in general. I recommend they decide, right? It's their body, it's their money, it's their life. They decide what we do. Um, so yeah, I think that answered that question. Any more? I don't understand the question in the Q&A about are there course notes on dysautonomia? You should be able to download the PowerPoint from the page that you use to get into this room. And there's also a couple of handouts, I think, on there that we're going to use in the class. Anybody have any other questions about practice management, patient management, that side of things? Yeah, it really could be an 8-hour class because people are complicated and can be difficult. And I know that everybody here, we want the patient to get better, right? And so we want to help. You have to balance, for me, I have to balance my motivation with the patient's motivation. I can't be more motivated than the patient. But I do want to help them. So I'm trying to find that window. Okay. I don't see any more questions. No more questions on that. Also, just FYI, if you have questions post-class, you're welcome to email me. Many questions don't require that we make an appointment, so I'm happy to answer over email unless I'm like, wow, this is going to take me a half an hour to type it. We should have an appointment. Where do I draw the line for how long I'll spend on a treatment plan? Okay, so if the patient is getting better, I'll work with them as long as it takes, but we need to see progress. So that's what the reevals are about. Usually I'm laying out about 3 months on the first one. I want to see significant progress in that 3 months. So what is significant progress? It's like 30, 40, 50% of their major complaints significantly improved, and something like a quarter or more of their major complaints totally resolved. Now, we may get way better than that. It depends on the complexity of the patient. Most of these patients have been trying things for, a decade. They have continued to get worse, not better. So if you can turn that in 3 months to a lot of significant improvement on the main things that are bothering them, that's massive. Then I'll keep going as long as it takes, because speed depends a lot on the patient. How well are they able to implement and how consistent are they? the people who take the longest are the ones that are always changing things in between appointments. I mean, there's some people who just feel the need to make changes, not the recommended changes, extra changes in between appointments. And it muddies the water so much that it just slows everything down. People want to do too many things at once. It actually slows things down because then when we're hitting a bump, we can't tell what caused the bump. And so it gets really confusing and complicated. The patients that move the fastest are the ones who just implement the homework, report back, and don't try to do anything extra. Don't try to get it extra credit. Just do the thing and report back honestly, right? Report back honestly. If things are not going well, to be honest. If they're having side effects, to be honest about that. And not try to make me happy, because we also get those patients who always want to say it's better and they kind of conceal things that aren't going well for whatever reason. They feel like, oh, it's the doctor, I have to make him happy. So if we can get rid of that and just have a nice, honest, open relationship, that works best. So if they're progressing, I'll work with them as long as it takes. Usually a year is the upper end of how long we work with people on a consistent treatment plan. Sometimes it's longer. Many of those people will go on maintenance. Maintenance is like they continue the stuff that we told them and they're still getting herbs. And maybe they have an appointment every month, every 2 months, every 3 months for a check-in. But they're not really on a treatment plan anymore. How did I decide how to charge? Yeah, charging is a complex question, right? So to me, there's multiple factors here. One is, what will people pay? That's important. I mean, you can't just, if you make up a number that no one will pay, you don't have a business. So what will people pay? It's good to look at what is kind of standard fee for either our field or similar fields. So like I look at people like therapists because I'm doing telemedicine now and looking at like what is standard fee for someone with my education level and for this amount of time. That's important. I'm also looking at what people in the functional medicine world and what some of these like Instagram wellness influencers who do not have medical degrees are charging for their coaching and advice. So I'm taking that all in. And then, there's also the question of access. Who do I want to have access to the services? And then how much money do I need to make in order to take care of myself, right? So these are all the questions. There's no there's no clear answer, right? It's going to depend on you, what's important to you, how much money you need to make, how much you want to work to make the money that you need to make, how important is it to be available to certain populations. My philosophy is, I mean, my appointments are not cheap by any means. They are significantly cheaper than people in the functional medicine space who are doing similar work to me. And I think what I'm doing is better because I also have Chinese herbs, which puts us at a huge advantage over these functional medicine doctors. They are, so many of their supplements are Chinese herbs, but they don't know how to use them. So it's just really messy the way they use them. It's not very effective. We know how to use them in a targeted, concise way that gets really fast results. And so I charge, a fraction of what functional medicine practitioners charge and potentially on the upper end of what people in the acupuncture world charge. Um, so yeah, I just came to it over time. I actually started really cheap. I purposefully undercut the everybody that I was competing against just to get people in the door. And then I raised my prices every year until I got to a price that seemed like reasonable for what I'm doing. So, my treatment plans are running, to between 2,000 and 4,500 for 3 months, includes herbs, doesn't include supplements. That is legitimately a lot of money. It's not very much compared to people in the functional medicine space who are charging that much just for an intake. So, yeah, if you've ever seen any of these doctors, people go there, they spend $10,000 to see the doctor 3 times in 3 months for 10 grand, and don't get better. Do I encourage feedback via text email between treatments? So what I want between treatments, I just want to know something's going wrong. The patient got sick. They tried the thing and they think it's making them sick. That's what I want in between treatments. I really don't want to do a lot of management over text and email because I just don't think it's very effective. And so unless something's going wrong, I prefer to discuss it in the appointment. But I will get back to them. Sometimes people just forget things. Oh, what did you say? What was the brand of the thing you recommended? Whatever. If it's something that we went over in the appointment and they're unclear, that's something I want to text on. Or if something's going badly, they don't feel well, I'm gonna text on that, right? Otherwise, I'd rather them wait until we're sitting down face to face to discuss and I can ask. I don't want to spend 30 minutes on a text when I could spend 30 minutes in a consult, right? So if I can do the text in a couple of minutes, fine. If I need to ask a lot of questions, I'd rather wait. Do I make custom herbal formulas? Yes, absolutely. I yeah, all my patients I'm prescribing custom. And so because now I'm in Mexico, I'm not making these formulas. So I make custom herbal formulas for myself and my wife. So I'm not making, I used to make the formulas and mail them to people from my clinic in Florida. I don't do that anymore because I'm in Mexico and that would be impossible. I pay a lot of money to get the herbs that I use for my own family shipped down here to Mexico for me. It's like a process getting everything through customs. So I do that, but I work with pharmacy on the East Coast where I send a prescription and they mail the formula out. Every time I do a class, I say this. I wish Evergreen had a pharmacy where I could do this. That would be my top choice. But they don't. And I've looked for pharmacies that carry primarily evergreen herbs. There's maybe one on the West Coast. I can't remember the name of it, but they're too hard to interact with. They don't have a good interface for me to submit prescriptions. So I submit these prescriptions online. I pay for it because the patients are paying for a treatment plan, including herbs. So I pay for it. It gets shipped to the patient. That's how I work it. How do I get herbs to patients out of the US? I'm not sure if you're asking about the patient being out of the US. I think I answered that I'm out of the US and that's how I do it. If they're out of the US, I don't know. It depends on customs. It probably won't get to them, to be honest. If you're in Mexico and you want herbs, you have to use a courier, like a mailbox service that will drive it across the border and then mail it from in country to you. Otherwise, it's not illegal. It just gets held at customs and it never makes it to you. So Evergreen, I'm pretty sure their policy is they won't mail to Mexico because it never makes it. And so that just makes unhappy people. It just gets held by customs forever. It never makes it to the person. So you have to pay a mailbox service. They receive it in the United States. They drive it across the border. Then they mail it to you. It costs an arm and a leg. It's awful. But at least I get my good quality herbs. Yes. Oh, Myra put something in the chat. Cura cura or cura cura, I don't know if that's Spanish or English, carries evergreen herbs and is able to mix the formulas for you. Okay, that's cool. I will check them out. Thank you. That's great. Yeah, I use Camwo Elham. That's who I'm using right now. But I got to be honest, the patients don't love the herbs with the glyceride base. So in my autoimmune class, we were talking about, to be aware of allergens in the herb bases. Evergreen has potato in the collection formulas and corn in the traditional formulas. just something to be aware of. For 99% of patients, it's not an issue at all. And some people were asking, like, who do I go to for the glyceride based? But the glyceride based are supposed to be non-allergenic, but the patients hate them kind of because the granule is so large, it doesn't dissolve right. And so there's all this gunk in the bottom, and they complain. They like the evergreen better because it's more smooth and dissolves better. So if I can get the evergreen to people, that is my preference. Okay. Any other practice management questions? We're at break time, and then when we come back, we're going to talk about dysautonomia, what we're here to talk about. But I think this is really, really important because you can have all the right information on how to treat a patient, but if you don't have a way to deliver it and to interact with them in a way that's effective, you still won't get results. And so, what good is the information? Any company that has tinctures that I trust for stomach cancer patient that can't take capsules. No, I don't know that much about tinctures and Chinese herbs. I would ask John Chin because the thing about tinctures is that so many of our herbs are supposed to be extracted in water. And tincture is an alcohol extraction, and it's not necessarily the same chemicals in a tincture versus a water. And I don't know which herbs are supposed to be extracted which way. That is like outside of my area of expertise, but John Chen does know. But if they can't take capsules, they should be able to take powders, right? That's my patients are mostly getting powders unless they want to pay extra for capsules. Um, So if they're the type of person that knows that they can't take something that's gross tasting, that they won't be compliant, then they can pay the pharmacy to encapsulate for them. Or some of my patients, I used some of the collection formulas. And so they can pay the higher price for the capsuled formulas. Like, if we're doing a detox program, liver DTX or dissolve GS, sometimes I'll send those just in the bottle. Okay, any other practice management questions, or shall we have a break? Do I ever take a backseat role when a patient is already working with another practitioner and wants to have my herbs muscle tested? Well, the patient can do whatever they want because they're an autonomous being. So there's not much I can do about that. I'm not a big fan of muscle testing, so feel pretty dubious about that. But there's nothing I can do, right? The patient's going to do what they're going to do. But if that creates like an inconsistency with following through on the herbs, it is going to interfere probably with our results, most likely. So, you know, I don't really get into it with people and their belief system. They really believe in muscle testing. Okay. I mean, there's not much I can do about that. I'm not going to argue with them. I just I just try to explain to them how important it is that we be consistent and that they, take the same thing consistently. Because some people will do this daily muscle testing. Do I need this today? And that approach to treatment is horrible. Like changing what you're doing every day. That is not good in my opinion. So yeah. I guess, if they said, oh, this muscle tested bad for me, I would probably try to give them another another formula. But yeah, that would be a barrier, in my opinion, to a smooth treatment process. But yeah, patients make their own decisions. I'm not the boss of the patient. I'm here to advise. Okay, let's take 10 minutes. So let's come back at 11 after, and we'll jump into dysautonomia. Thanks for engaging.